have Dr. Santosh Agrawal is already there, and an innovative, simple and novel AC paracentesis device.
So, respected judges and chairman's desk, very good morning to all. I am going to present a video on and also some text on intravitreal injection, my innovative technique. It is more of a technique than a device. So as you know, intravitreal injection widely used to administer anti-VEGF, triamcinolone, antibiotics, TPA, etc. What are the risk factors involved in intravitreal injection is vitreous incarceration in the wound, vitreous weak through scleral tunnel, a bleb formation at the end of the injection, immediate increase in IOP which can endanger the optic nerve perfusion, and transient CRA occlusion. Increased risk of endophthalmitis because vitreous can adhere to the needle wound, and RD can happen because of the vitreous traction that can cause RD. So this is my simple and novel AC paracentesis device wherein 26 or 30 gauge needle is used and its hub is mounted on a sterile Johnson bud. It remains inside antechamber throughout the injection to drain out aqueous as the intraocular volume increases because of your intravitreal injection. The chances of iris and lens touch can be avoided by piercing the needle at limbus tangentially into antechamber. Just the bevel is partially, just the tip of that bevel is inside the antechamber. So even if it moves, it will not damage intraocular structures. So the advantage is no immediate hypotony because you are have a guarded outflow or egress, and there is no AC collapse as against direct bare needle entry. While giving intravitreal injection, aqueous drained out slowly in a guarded fashion, soaked into the tip of the bud. Avoid immediate rise in IOP and its potential complications. Mostly useful when triamcinolone or multiple injections are given in endophthalmitis. No vitreous or drag reflux at the site of injection. No vitreous weak, its potential complications. Less chances of endophthalmitis and RD. So I have done the studies also. I won't go in detail. Just this is the small video. This is my pre-injection paracentesis needle. I have just pierced in the antechamber. The tip is just inside. It is not touching the corneal endothelium or the iris. And I have already given the injection. The volume is taken care of by that AC paracentesis device. So how I make it, just to show it, it's just Johnson bud I have pierced into the hub of this needle. You can use 30 gauge needle also. This is a very simple, inexpensive device. No money is required. And this is the intravitreal injection. This I am piercing this just inside. Even if it in phakic eye, it will not harm, it will not move. Even if it moves, nothing will happen. For last 5 years, I am using this technique, and it's very rewarding, no pain to the patient. And this, again, the same technique, this patient's response, I think sound, I think, please volume, audio visual, audio.
इंजेक्शन दिया है हाँ तो इंजेक्शन के मेरे को चीटी काटते इतना भी दर्द नहीं हुआ
बिल्कुल भी दर्द नहीं
हुआ मालूम भी नहीं पड़ा इंजेक्शन दिया कि नहीं दिया
So this is a very good advantage that the patient don't feel any pain because there is no increase in the volume of intraocular pressure.
Okay, तो अभी आपको ठीक लग रहा है, कोई तकलीफ नहीं है, कुछ भी
तकलीफ नहीं मेरे को
चलेगा. Okay, thank you.
So it's the patient's feedback. So we have done the studies, and I will go to the directly to the discussion. Bleb formation is very less, 0.8% as against 20% in other studies. CRA occlusion 1.61% as against 30%. Vitreous incarceration, RD, and endophthalmitis all were very, very less in our studies. And pain during procedure was null. So dramatic effect of this new technique on intraoperative and postoperative were observed. There is hardly any bleb formation, vitreous incarceration, or any other related potential complication observed, and there is no pain. So to conclude, this is a simple, inexpensive AC paracentesis device which is found very useful in all types of intravitreal injections, especially in triamcinolone and multiple injections in endophthalmitis. Thank you very much for your patient listening.
A fantastic idea. I think very practical and very fantastic to especially for those who have raised, and generally when they give intravitreal, they say you should have a reflux, so that takes care vitreous doesn't come out.
Come up.
Yeah.
Thank you, sir. Thank you so much.
Dr. Agrawal, I have a quick question for you. It may decide the price also. Are you the same Santosh who was doing fellowship when I was back in Shankar Netralaya as a postgraduate?
Yeah. Thank you.
Dr. Santosh sir, out of the judges' question, so do you do this AC paracentesis in all the cases of intravitreal injections or only in cases where you have the risk of glaucoma or the patient is already a glaucomatous patient?
Yeah, in those cases that is mandatory, I think.
No,
And
I'm
also
asking
in
whether
multiple injection in endophthalmitis. And also in triamcinolone because it's a high volume. Mostly in triamcinolone.